Why does correct Kegel technique matter for bladder health? Have you ever wondered why the way you perform Kegel exercises is so important for your bladder health? Correct Kegel technique is essential because it helps strengthen the pelvic floor muscles, which support the bladder and urethra. When these muscles are strong, they can improve bladder control and reduce urinary incontinence. However, if Kegels are done incorrectly, they may not be effective and could even worsen symptoms by increasing muscle tension or causing strain. The pelvic floor muscles act like a supportive sling for the bladder, uterus in women, and bowel. Weakness in these muscles can occur due to various factors such as aging, pregnancy, childbirth, surgery, obesity, or chronic straining from constipation or coughing. When these muscles weaken, bladder control may be compromised, leading to issues like urine leakage or urgency incontinence. Kegel exercises involve tightening and relaxing these muscles to restore their strength and function. To perform Kegels correctly, you first need to identify the right muscles. A good way to find them is by mimicking the action of stopping urine flow or preventing gas from escaping. It is important not to tighten your abdomen, thighs, or buttocks during this process. Once you have identified the muscles, contract them for a few seconds, usually between 2 to 10 seconds, and then fully relax them. Aim to repeat this cycle about 10 times per session, several times a day. Be careful to avoid excessive or incorrect contractions, as these can lead to increased muscle tension or pain. When done correctly, Kegels can increase resistance around the urethra, helping it withstand increased abdominal pressure during activities like coughing or sneezing. This can significantly reduce stress urinary incontinence. Additionally, they can help manage urgency incontinence by improving control over the pelvic muscles. On the other hand, incorrect technique can lead to muscle fatigue and increased pelvic tension, potentially worsening symptoms. Therefore, it is advisable to seek guidance from a healthcare professional to learn the correct method and ensure that the exercises are tailored to your individual needs. This is especially important for those recovering from surgeries like prostatectomy or other pelvic procedures. In summary, mastering the correct Kegel technique is vital for effectively strengthening the pelvic floor muscles that support bladder function. This can help prevent or reduce urinary leakage and enhance overall bladder health. Without proper technique, the exercises may not yield benefits and could lead to discomfort. Regularly performed Kegels, done correctly, can be a valuable part of maintaining bladder health and aiding recovery after pelvic or bladder-related medical conditions.